Hello and welcome. Today's topic is our feto-placental circulation. A blood circulation which occurs inside the fetus through the placenta. An entire circulation process takes place on among placenta, umbilical arteries, umbilical vein, foramen ovale, ductus venosus and ductus arteriosus. Okay. Now try to understand the placenta. How placenta develops you already know. So it is a site where the gas means oxygen, carbon dioxide, nutrition for the baby and other substances like waste materials and blood are exchanged in between mother and embryo or fetus. Okay, now try to understand this oxygen rich and nutrition rich blood enters into the fetus from the mother through one umbilical vein. Now the major quantity of the blood enters into the inferior vena cava through the ductus venosus. Okay, now this ductus venosus bypasses the liver through the left branch of the portal vein and the entire major amount of blood enters into the inferior vena cava of the baby. Small quantity of this fresh blood enters into the hepatic sinusoid and from there it enters into hepatic veins and indirectly it goes into inferior vena cava. From the inferior vena cava, the entire blood goes into the right atrium of the baby. The minor portion or small amount of blood enters into the right ventricle. From the right ventricle, it enters into the pulmonary trunk. Okay, and the major portion enters into the left atrium through foramen ovale. This foramen ovale I already told you in my last video. Now, what is foramen ovale? You already know. So it's actually a foramen or is a hole area or gap area in between right atrium and left atrium, and it presents in between interatrial septum. Okay, so for these the entire major portion of the blood bypasses the lung, directly enters into the left atrium. So the fresh blood, it doesn't have to go into the lungs. Okay, from the pulmonary trunk, major portion of the blood or major quantity of the blood again enters into the right pulmonary artery and minor amount of blood enters into the left pulmonary artery. Okay, from the right pulmonary artery the entire blood enters into the lung because lung has to develop, and the left pulmonary artery the entire blood divides into two segments. Major portion enters into the ductus arteriosus and it enters into the aorta, but the minor portion enters into the lungs again. Okay, so this ductus arteriosus, it is also bypasses the lung and directly enters into the aorta. Now the blood which entered into the lung from the right and left pulmonary artery, this blood enters into the four pulmonary veins. Amount of the blood in the left atrium is more because it's coming from the right atrium and from the lungs directly. So the entire blood enters into the left ventricle and from the left ventricle it enters into the aorta. Okay, now this aorta distributes the blood into the whole body of the fetus. Okay, how? Follow this arrow line that this aorta divides itself into two segments. One segment above the umbilicus, one segment below the umbilicus. Okay, above the umbilicus means the body parts are present above umbilicus, means thorax, upper limb, then head, neck. So from there these bloods drained via superior vena cava and ultimately again enters into the right atrium. Okay, and rest of the portion which is below the umbilicus means abdomen and lower limb, this also again after distributing it enters again into the inferior vena cava. Now after distributing the entire body of the fetus, remaining blood enters into the two common iliac arteries. From there, two common means right side, left side. Okay, from there it has internal iliac artery, right side, left side, and from that it directly forms two umbilical artery, right side, left side. Now these two umbilical artery joins again into the placenta. Now this blood consists of carbon dioxide, body waste of the baby and other substances, ultimately comes back to the placenta. Now the blood of the placenta again purifies into the mother's body and again enter into the baby. What happens after birth? See, when the baby delivers through the normal delivery or the cesarean section, doesn't matter, whatever the process the baby delivers, after delivery we cut off the umbilical cord. So first what happens, the baby has central nervous system which triggers the lungs to immediately expand and takes the first breathing. First breath means oxygen and follow it cries. Okay, now because we slough out the placenta and cut the umbilical cord, the baby is not getting blood supply, so the baby's central nervous system again triggers the cardiovascular system to reform and reshape the circulation. So following process occurs. First of all, this ductus venosus, okay, ductus venosus converts into ligamentum venosum. So the function of the ductus venosus closes. Ductus arteriosus converts into ligamentum arteriosum. So the function of the ductus arteriosus closes. Two umbilical arteries converts into superior vesical artery and median umbilical ligament, gone. One umbilical vein converts into ligamentum teres hepatis. See, try to understand. This umbilical artery and umbilical vein also presents in the placenta, also presents small amount inside of the baby. Okay, whatever the presence small amount inside of the baby, this converts into superior vesical artery, median umbilical ligament, and ligamentum teres hepatis. In my last video, I told you that this foramen ovale closes within 2 to 3 minutes after birth, but actually it starts closing and it takes place around 8 to 9 months after birth, and it permanently closes. If it is not closed, then it requires surgery. Okay, anyway, these things I will talk about later, not now. So after birth, what happens? The blood enters into the right atrium via superior vena cava or inferior vena cava. This blood enters into the right ventricle. From the right ventricle, it goes into the pulmonary trunk. From the pulmonary trunk, it enters into the lungs. Okay, from the lungs, it enters into the right atrium through the pulmonary veins, and from the left atrium this blood enters into the left ventricle. From the left ventricle it enters into the aorta, and aorta distributes the fresh blood. Okay, so this is the normal adult circulation after birth. This is the fetal circulation before birth inside the mother's womb. Okay, three important points: ductus venosus, ductus arteriosus, and foramen ovale. Here these 3 points, fetal blood does not enters into the lung. Okay, it bypasses or takes shortcut route, directly enters into the heart. Okay, so I hope you a little bit understand, and see you in my next video. Till then, bye.